All right, my name is Brendan Boyle. I'm a physical therapist at our Attleboro location on Commerce Way, and we're going to go through a few easy home exercises to do for patients who have a diagnosis of knee arthritis. The first exercise we're going to do is a stretch for your hamstring muscles. Those are the muscles that run across the back of your thigh. This is an exercise we can do sitting in a chair. So our patient, to stretch their legs, they're going to scoot up a little bit in the chair. They're going to put one leg forward with their heel up like that. That's the leg we're going to stretch. The way we're going to get this stretch is we're going to lean forward and reach towards our foot. We want to make sure that we're leaning forward from our hips and not bending the back. If we bend from the back, we're going to be able to reach very far, but we're not going to feel the stretch. We should feel a stretch very gently on the back side of the thigh. Once we feel a gentle to moderate stretching sensation, we want to hold that for 30 seconds, and then we're going to switch legs and do that on the other side. If you're following along with the video, you can pause now and try 3 reps for 30 seconds on each side. All right, the next couple exercises we're going to do are good strengthening exercises for your quad muscles. Your quad muscles are the muscles that run across the front of the thigh, and they play a really important role in stabilizing your knee. The first exercise we're going to do, we're going to take a pillow and put it underneath both legs, just behind the knee. This first exercise we'll call a Shortarc Quad. Basically what we're going to do with the leg that we want to exercise with, we're going to straighten it as straight as we can. You want to feel the muscles on the front of the thigh tensing up. You can relax back down. We don't necessarily need to hold this exercise. We can raise up, pause just for a little bit, and then right back down. You want to make sure your knee is getting as straight as it can and that you're feeling like the muscles on the front of your thigh are creating that motion. You can do a set of 10 on one leg and then switch to the other leg. It's a good idea to start with 2 sets of 10, and then once that gets easy, bring it up to 3 sets of 10. If you're following along in the video, you can pause now and try maybe 2 to 3 sets of 10 on each leg. Okay, so once that exercise gets too easy, even if you're doing 3 sets of 10, we can do another exercise that we call a straight leg raise. So if our patient's going to be exercising their right leg, we're going to bend the left leg up just so that foot is resting flat on the table. What we want to do with this exercise is we want to tense that quad muscle, so squeeze those same muscles we were using in the Shortarc Quad exercise, and raise the leg up in the air, keeping the knee as straight as possible. We don't need to go higher than the other leg, and then we can raise back down. This is another one where we don't necessarily need to hold it at the top. We want to raise up, pause for a split second, and come right back down. Make sure this motion is slow and controlled, and you're not letting gravity pull you down too fast. This is another exercise we can start with a set of 10 on one leg and then switch to the other leg. We can start with 2 sets of 10 on each side, and once that gets easy, we can go up to 3 sets of 10. This would be a good exercise to add an ankle weight if you have it at home. If not, you can just do more repetitions. Maybe after 3 sets of 10, you can do 3 sets of 12, 3 sets of 15. You want to feel the muscles on the front of the thigh working with this. Our next exercise is going to be a stretch for your quad muscles. Again, the quad muscles are the muscle group that run along the front of the thigh. Sometimes they can get a little tight when you have knee arthritis, so it's important to stretch those out. So we're going to stretch our patient's left leg. We're going to use this strap, but if you don't have a strap like this at home, you can wrap a belt, a towel, a dog leash, whatever you have, around your ankle or foot. When we stretch this, I'm going to pass this over the opposite shoulder of our patient. If we go over the same shoulder, sometimes that knee will rotate too much to the side and it can put some strain on the inside part of the knee and be a little bit painful. Our patient's going to pull gently on the strap to bend her knee until she feels a comfortable stretching sensation on the front of her thigh. Once she feels a gentle to moderate pulling sensation on the front of the thigh, she's going to hold that for 30 seconds and then relax. Just so we're not changing back and forth too much, she can just relax for a few seconds and then go right back into the stretch. We can do 3 repetitions of 30 seconds on one side, then we can switch so we have the strap on the other leg and it's going over the other shoulder, and we can do 3 reps on that side as well.